This patient's a 63-year-old female with recurrent prepatellar bursitis who elected to have her prepatellar bursa removed arthroscopically. One of the advantages of doing this type of procedure arthroscopically is the skin over the prepatellar bursa can sometimes be compromised. And so what you're looking at now is a view inside the bursa itself. You can see the walls around that shaver, and what we're doing now is debriding the area over the infrapatellar tendon. And now we're just going to go ahead and take that burr from inside that cyst or wall-like structure and go ahead and start to debride the walls of the bursa. This can take a fair amount of time to do. Those walls can be fairly thick, and what you will attempt to do is deliver that wall to the shaver with using pressure from outside, just sort of pushing on the walls to try to get an edge so that the shaver can remove them. When you initially put the arthroscope inside the wall of this bursa, the whole thing deflates, but then we go ahead and use fluid to re-inflate it and then start to chew away at the walls to remove the cyst. That's essentially what you're seeing here. You can see that the wall to the right or to the left of the shaver here has been removed, and you can see some subcutaneous fat off in the distance. We're just continuing again to debride with the shaver. And working on the other side now. You can see sort of the subcu fat appear as you get through the wall of the cyst. You have to be careful to control the suction on the shaver too, because the whole thing collapses and it makes it difficult to see. Now we're working more towards the inferior aspect of the cyst. Doing a complete debridement. You have to look at this from several different angles to make sure you get the whole wall of the cyst. What we do is we'll switch out the shaver and the arthroscope, so we're looking at different directions and making sure that we go ahead and debride the whole thing. And again, what you're seeing at the bottom there is fibers of the infrapatellar tendon come into view. You see cyst wall overlying those fibers as well. Just continuing to clean things up. You can see the resection is pretty complete there. And now we're going to just go ahead and introduce a drain arthroscopically into the cavity there to let the blood drain out so the cyst doesn't reform. The prepatellar bursa, I should say, reform.